I think ultimately WHO needs a scope of activities that reflects what its member states want. And when you have, you know, most of the countries in the world as member states of the organization, then that is inherently going to be a very, very broad, sweeping mandate and set of priorities. Um, I don't know if it's feasible to narrow. It's not feasible to narrow that uh, if you're sitting in the director general's chair, because ultimately the director general has to be responsive to what the member states want to see, and it's always this kind of back and forth process between WHO, the agency, and their leadership, and the signals that they're getting from the member states. Um, I think certainly there are certain, there are things that we want to see WHO prioritize. We need to see them be very strong on emergency response because they fill a niche there that no one else can fill. I think we want to see them be very strong on providing technical support and guidance to the developing world because in many developing countries, WHO is a sort of proxy extension of the health ministry. And they need to be strong on things like vaccines. So there are a lot of different things. They also play a really important role on technical collaboration and convening. So on innovative medical research agendas and things like that. These are things that really no one but the World Health Organization and no structure but a multilateral institution can deliver. And I think um, inherently there are just a wide range of things that we need them to do. And so I don't think kind of radically downsizing their mission would be the solution. But um, I do think we also need to recognize that WHO is being asked to do a wide range of things without necessarily getting the kind of resourcing that they need in order to do that effectively. And so WHO's budget is a fraction of the budgets of the US CDC and NIH, despite having responsibilities that cover a lot of the same ground. Um, it's a smaller annual budget than even a US city's hospital system in most cases. So they are being tasked with a huge amount of work on a very, very small annual budget. And I think that is hopefully one of the takeaways from what we're seeing now is that if we want WHO, as I think we do, to be an operationally competent, technically competent uh, emergency response organization, amongst other things, they need to be resourced. They need to be resourced to have the kind of technical depth that they are struggling to finance now. They need to be resourced to build the kind of operational surge capacity that they are building, but still, I think, not where they need to be. But I think the answer is set the agenda that we want them to pursue and then finance that appropriately rather than set the agenda we want them to pursue and then chronically underfund them.